Hello, I'm Pam and I'll be performing an NG tube insertion. What I will do first will be verify my orders, review the medical history, ask if the patient had any nasal surgeries or any deviated septum surgery. I will gather my equipment and perform hand hygiene. What I'm going to do is I'm going to identify the patient by two identifiers. I will provide for privacy, assess the patient's mental status with 3 questions. I will explain the procedure and will establish a stop signal. I will go ahead and actually assess the abdomen first. I will assess the nerve for patency and skin breakdown, and I will position the patient in a high-polished position. I will drape the chest with a bath towel, and I will go ahead and perform hand hygiene and put on gloves. What I'm going to do next is I'm going to measure the tube for before I insert it. And the way I'm going to do that is by the end of the tube, or the beginning, from the earlobe to the nose, and then from the earlobe to the xiphoid process. And I'm going to end up marking this spot with a marker. I will lubricate the tip of the NG tube 2 to 4 inches, and then I will instruct the patient to keep their head back on their pillow, and I will start inserting the tube. Once I get to the pharynx, I will ask the patient to move their head, to bend their head forward, and then I will give some water, and I will ask the patient to swallow, and every time when they swallow, I'll insert it 2.5 to 5 centimeters or 1 to 2 inches. I will advance the tube until the designated spot, and I will secure it with a tape to the nostril just by the time I can figure out placement. And there's a few ways to do placement. I will assess the patients for respiratory distress. I will go ahead and I will measure my pH. I will put some 10 milliliters of air, and then I'll aspirate. And after I aspirate, I will put it in a pH strip and measure it, and I want it to be between 0 and 4. And the next way to verify placement would be by an x-ray, or I can observe the visual characteristics of my aspirate. And then once placement is confirmed, I'll mark the tube exit with the tape, and I'll put this on the patient now and just tape it. And I will measure the exposed length of the tube, which will be part of my documentation. I will clamp and remove the syringe, which I already did, and I'm just going to clamp with this. And I will secure the NG tube with a rubber band and a pin to the gown. I'll provide with oral hygiene, and I'll return the patient to a comfortable position. I will remove my gloves. Just right before I remove my gloves, I'm actually just going to connect the tube to the suction, and then I'll remove my gloves, and after that I'm just going to remove my gloves, perform hand hygiene, and document the procedure, and that'll be it.